This sixth lesson focuses on supporting family caregivers in providing care of someone with Parkinson's disease. Parkinson's disease is a progressive neurodegenerative disorder resulting in significant disability. Most patients have somebody who is providing care and support of themselves. Parkinson's disease affects enormously the daily living and quality of life of a patient, but can also have a wide range of effects on the carer's life. This session will cover the following subjects: who is a carer and what do they do? What is a unit of care? What are the rights as a carer? What are the basic caring skills for people looking after someone with Parkinson's disease? Which are practical aids and adaptations to help with caring for the person with Parkinson's disease? Being aware of stress and managing one's emotions as a carer. Importance of burnout prophylaxis of a carer. And accepting outside help and sharing the caring tasks, support groups. To begin with, we look at definitions, about unit of care, caring and caregiver as well as palliative care. The term care is used to describe an activity when one is looking after, providing support or assistance with various activities to someone who is ill, elderly or disabled. Care includes attention to any of the needs of the person, including hands-on care, overnight care, respite, shopping, collection of medications, taking to appointments, emotional support, bathing, etc. The term caregiver is used to name someone who looks after and takes care of the physical and emotional needs of a disabled person. Caregiver is usually a spouse, a close relative, friend or neighbor. The term unit of care is used to describe a system that consists of the patient and their family, who are the focus of a plan of care. The term palliative care is the active holistic care of individuals across all ages with serious health-related suffering due to severe illness, and especially of those near the end of life. It aims to improve the quality of life of patients, their families and their caregivers. People become carers for different reasons. Some people become carers without realizing it, as their relatives' Parkinson's disease progresses and they become more dependent. If people end up doing caring tasks that they resent, then frustration and guilt develop and nobody benefits. It is vital that carers decide what they are and are not prepared to do at an early stage, so that if necessary alternative solutions can be explored. Caring alone at home is not always the best option for carer or cared for. Caring for someone can be very rewarding. However, it can also be physically and emotionally demanding and affects work, home, family life and free time. In order to maintain their own health, carers need to ask for help and time off from caring. Being a carer does not mean taking over everything. It is important that the person being cared for is encouraged and allowed to do as much for themselves as possible. This will help to maintain their independence and dignity. There are several challenges and benefits possibly perceived from the caregiving. For example, social isolation, work, emotional, physical, financial and family relationship strain could be a negative consequence of caring. On the other hand, satisfaction of helping a family member, success feeling of developing new skills and competencies or improved family relationships could be perceived as benefits of caring. There is significant evidence that the Parkinson's disease patients together with their families have a high palliative care needs. Palliative care refocuses attention on the family as the unit of care. It is important to understand the experiences of family caregivers who take on caring tasks in order to ensure they receive the necessary support. Caregivers of patients with Parkinson's disease have considerable needs that may be met through a palliative care approach. Palliative care can identify pressure points for the patient-caregiver dyad and allow early interventions to ease burden. Caregivers should be able to have access to emotional support and education regarding the course of Parkinson's disease, how to handle emergent situations, for example falls and psychosis, and medications. Caregivers who have access to specialized palliative care services have fewer unmet needs than those who do not have access to palliative care. Caregivers willing to access palliative care services may have a better outcome because of problem-focused coping strategies. But what are actually the legal rights as a carer? Caring for someone with Parkinson's disease can be physically demanding and emotionally exhausting, and it's likely you'll need a wide range of support. A carer should ensure that his or her own health and need for information are not neglected. A carer has certain legal rights. Firstly, to choose not to care. Secondly, to have your own needs assessed by local social services, separately from an assessment of the needs of the person you care for. Thirdly, to be consulted at time of hospital discharge and to receive appropriate assessment and support. It is important that the psychological as well as physical needs of the carer should be recognized. Unless the person under care objects, it is advisable the carer to accompany patients to visits to the doctor and to have a full knowledge of their medication and any special care needs. All carers need regular breaks to give them time to keep on top of problems and to recharge their batteries. Let's see now what basic caring skills are needed. Few carers have any training for the role and most learn how best to help by trial and error. You should try to have realistic expectations of the amount of care that is required and of what you can provide. The needs of people with Parkinson's disease will tend to change over time and their abilities can also fluctuate from hour to hour. Consequently, their care needs are not constant. You should try to encourage independence, offering support and help when required, but not taking over. Being a carer does not mean doing everything. Understanding the nature of Parkinson's disease, its treatment and the range of services available is necessary if you are to provide effective care. The more you understand, the easier it will be to work through day-to-day problems and to play an active rather than a passive role in management. Symptoms of Parkinson's disease are often made worse by stress and pressure. Try to be a calming influence and avoid pressuring them to speed up. Help them to have the time and space to accomplish tasks by themselves. As a partner in care, you need to work closely and confidently alongside all the health and social care professionals involved, so that the needs of the person you are looking after, as well as your own needs, are best met. The partnerships you form should help to maintain the independence and dignity of both of you. Knowing how to get the best from Parkinson's disease treatment is essential. Ask the doctor, specialist nurse or pharmacist, to explain this to you and check that the person you are caring for is taking their drugs as prescribed. Try and accompany the person with Parkinson's disease to medical appointments, so that you can discuss concerns at first hand. Caring involves looking after psychological as well as physical needs. Try to ensure that family and friends maintain contact and keep memories alive through visits, photographs and letters. It is likely to be helpful and more enjoyable if you do things together. Always remember that everybody needs help at times and you should not be hesitant about asking for it. The best way to provide understanding, emotional support and physical help will depend on what you and the person you care for decide. We go on to discuss some practical aids and adaptations for caring. Caring for someone with Parkinson's disease may often involve helping them to move round. It is important that you are fully prepared and do this the right way. There are some general rules to keep in mind and try to follow when helping with lifting and moving the person with Parkinson's disease. Make sure the immediate environment is safe and remove any obstacles. Always warn the person you are helping what is going to happen. Try to ensure the height you are working is suitable. A higher chair or extra mattress on the bed may make it easier. Encourage the person you are moving to do as much as possible themselves. Try to move by rolling, tilting, or turning and lift as little as possible. When you must lift, Stand close to the person, spread your feet apart so that you have a stable base, always bend your knees and/or hips and not your back and tense your stomach muscles. The physiotherapist can demonstrate safe lifting and moving techniques and practice them with you. Using practical aids, appliances and adaptations helps people with Parkinson's disease to be more independent. In turn, this means that it is easier to care for them, and everyone has a better quality of life. Aids and appliances might include small pieces of equipment to help with daily living activities, such as bathing aids and adapted cutlery and cups for eating and drinking, or larger pieces of equipment such as electrically operated beds, stair lifts and wheelchairs. Adaptations range from simply rearranging furniture and removing or securing potential dangers, for example loose rugs, electric flexes, poor lighting, to installing ramps instead of steps, or building new toilet or bathroom facilities. Let's look at the healthcare team. The healthcare team that surrounds the person with Parkinson's disease and the family consists of multidisciplinary professionals that can help them manage their illness as well as its effects on quality of life. Central to the team is the person with Parkinson's disease and their family. They live with the condition 24 hours a day and soon become experts. If health and social care professionals acknowledge patient and carer expertise and work together with them, then outcomes are likely to be most satisfactory for all. Physiotherapists can help the patient to become more mobile and make them more comfortable. They are best qualified to advise on mobility aids. Occupational therapists are best qualified to advise on what aids may help you with daily living. Speech and language therapists provide support and care for people who have difficulties with communication, or with eating, drinking and swallowing. Nursing staff can monitor the effects and side effects of the treatment used to control the disease, and they can help in managing drug titration. They can advise on avoiding skin problems, such as pressure sores, if the person you are looking after is immobile and on the most suitable continence, aids if there are problems with bladder or bowel control. Neurologist is a principal care provider, who will organize the treatment of a disease and advise the primary care physician managing the patient's overall health. Psychologist can provide psychological support and counseling that can help with depression, anxiety, hallucinations, and confusional states. Nutritional therapist can provide a nutritional assessment and give nutrition recommendations. Social worker can help people with Parkinson's and their families navigate the healthcare system, work through common disease transitions and connect to community resources. We go on to discuss the importance of burnout prophylaxis. Caregivers of patients with Parkinson's disease are subjected to different problems that influence their health, social life, financial situation, and quality of life. Caregiver burnout and strain negatively affect patients and caregiver health. The emotional stress of providing care is in general more burdensome than the physical demands and financial strain. Most carers find that they become more easily stressed. Many feel constantly tired, depressed or lonely. You may find that caring gives rise to a range of emotions. Often there is a feeling of grief and loss of emotional and sexual companionship of a friend and partner, personal identity, hope and plans for the future, income and financial security, and social opportunities and outlets. Feelings of emotional pain and sadness, of isolation, loneliness, frustration over lack of choice and loss of control are common. The sense of being alone, with no one else really understanding the true situation, and the unpredictability and fear of what may happen next can be emotionally draining. Many carers find that they lose the ability to relax and can become depressed and anxious. People adopt different kinds of coping strategies to solve personal and interpersonal problems. Problem-focused coping is aimed at changing or eliminating the source of the stress. This means taking control, seeking information, and evaluating the pros and cons. Also, emotion-oriented coping may be useful in certain situations. Seeking solace in nature, meditating, reading books, but also humor, are described as passive, however, powerful ways of dealing with emotions. Some self-awareness is needed in both coping styles. Some selected strategies might cause self-harm over time, others might hurt our close ones. So the question for self-check should be, is this strategy still helpful, or am I causing harm inter- and intrapersonally? Ignoring the source of stress may lead to self-destructive behaviors. Asking questions, why? And why me? Are helpful to find meaning in various life events, as well as seeking support. As a carer, it is easy to become so focused on the needs of the person you are looking after that your own health begins to suffer. This will not help either of you. Looking after your own health is an essential part of caring for someone else. Take time out from caring to eat, exercise, and to relax. You need to keep as fit as possible and to eat a balanced and varied diet, with plenty of fresh fruit and vegetables. Watch your weight and avoid under or overeating. Drink adequate fluids, 8 to 10 cups a day are recommended, and use alcohol only in moderation. Avoid smoking more cigarettes and give up, if possible. Even though you are physically active as a carer, you should try to make time for regular exercise. Simple activities such as moving to music, a brisk walk to the shops, or some gardening will help to make you feel more energetic and provide a break from your daily routine. Try using the car less. Group activities, such as rambling, dancing or swimming, are healthy and fun and provide an opportunity to socialize as well as exercise. Try to avoid becoming too stressed, by learning to relax, to manage your time efficiently, and to get regular sleep. Don't feel guilty accepting help when it is offered. Put at least a few minutes aside each day to consciously relax and relieve muscle tension in a quiet room without disturbance. There are 3 main ways to help you to cope with stress. Relaxation techniques, such as progressive muscle relaxation, calm down bodily reactions and increase sense of well-being. To benefit most from relaxation, you must practice on a regular basis. Put time aside each day. People with Parkinson's disease will also find that relaxation techniques help their tremor and muscle stiffness. Your thoughts can also contribute to how much stress you are experiencing. Negative thoughts increase stress reactions and make it more difficult to deal with situations. For example, I will never learn to cope with this situation. It is helpful to identify such negative thoughts and then to generate alternative, more positive, stress-reducing thoughts. For example, I will relax and approach the situation step by step. Finally, you can test out your positive thoughts in situations of everyday life. Your activities will also help you to cope with stress. Planning in advance what activities you are going to do will prevent overload. Making sure that you spend time doing some pleasant activities will make life more enjoyable and help you to recover after stressful experiences. Progressive muscle relaxation requires only 10 to 20 minutes per day to practice. It is very important to incorporate this technique to your everyday routine. You should find a good place to conduct the relaxation. The room should be warm and comfortable, free of distractions. Later on, when more experienced, you can perform this new skill in the stressful situation wherever you are. You can practice this technique seated or lying down. This is how it works. While inhaling, contract one muscle group, for example your upper thighs, for 5 seconds to 10 seconds, then exhale and suddenly release the tension in that muscle group. Give yourself 10 seconds to 20 seconds to relax, and then move on to the next muscle group, for example your buttocks. While releasing the tension, Try to focus on the changes you feel when the muscle group is relaxed. Imagery may be helpful in conjunction with the release of tension, such as imagining that stressful feelings are flowing out of your body as you relax each muscle group. Gradually work your way up the body, contracting and relaxing muscle groups. When people are tense and anxious, their breathing becomes much quicker and superficial. That kind of anxious breathing may precipitate symptoms like tremor, heart beating, pins and needles in hands and legs, as well as dizziness. These symptoms can quickly be controlled by correction of the breathing. This breathing pattern aims to reduce anxiety or help people get to sleep. Before you start with the breathing exercise, you should choose a good place. It could be in your bed, on your living room floor, or in a comfortable chair. Try to incorporate this technique to your everyday routine, for example twice a day. This is how it works. Inhale deeply and slowly through the nose, for example for 2 seconds, hold the breath for 3 to 5 seconds, then exhale slowly, forcefully through the mouth for 4 seconds, pursing the lips and making a whoosh sound. Repeat the cycle up to 4 times. You may do more breath cycles in a row when you have more practice with the technique. You may feel lightheaded after doing this for the first few times. Therefore, it is advisable to try this technique when sitting or lying down to prevent dizziness or falls. The more consistent you are with taking time for yourself to relax, the better you will be as a carer in facing the situations which tends to cause stress levels to rise. Relaxation alleviates anxiety, feeling of sadness and emotional tiredness. Incorporate relaxation into your daily routine, perhaps by putting regular time aside for watching a favorite television program, listening to music, a leisurely walk, or an unhurried bath. Listening to a relaxation tape, counseling sessions, yoga, aromatherapy or reflexology may all be beneficial. Caregiver burden is associated with caregiver depression and anxiety. Interventions which aim to alleviate caregiver mood disturbances should be considered in the Parkinson's disease population as part of comprehensive palliative care. As the spiritual well-being is associated with the caregiver burden, the caregiver spiritual counseling or pastoral care might mitigate the psychological effects of burden on caregivers. We will discuss this aspect of care more accurately in one of the upcoming lessons. However, there is significant evidence that higher spiritual well-being is associated with less impairment in quality of life, lower anxiety, lower depression, fewer non-motor symptoms, reduced palliative symptoms, and less prolonged grief. Carers with higher burden and depression experience more anticipatory grief symptoms. Care partners are frequently faced with ongoing and anticipated losses from incurable neurodegenerative illness. Anticipatory grief may be more common in persons caring for someone of younger age, or with high non-motor symptom burden. Also, this topic will be discussed in upcoming lessons. To improve carer outcomes, carers should receive regular psychological assessment and support. Finally, we will talk about sharing the caring tasks and the importance to accept support groups. Most family carers and friends regard caring as a duty. For many it is an act of love and they take on the role with great commitment. This can make it difficult for them to let go and to accept help from others. People with Parkinson's disease will inevitably need more help with caring as the condition progresses. As time goes on, it is seldom possible for one person, however committed, to provide all the care that is needed. Having time off from caring has advantages for both carer and cared for. It allows you to recharge your batteries and to maintain a positive relationship. The aim of involving outside care services should be to support family carers and friends, so that they can continue to care for as long as they wish. It is not a matter of failure or relinquishing your responsibilities. Allowing strangers into your house to share care, or encouraging a breakaway for a short time can be a very difficult step. It is usually best to accept help when it is offered. Accepting help sooner rather than later can help to maintain quality of life of both cared for and carer and may avoid a crisis. Looking after someone can be very demanding. It's a 24-hour job. At times when a break is needed, not only from daily chores, but also from the cared person. A break from time to time is needed to look after carers' own needs. This is called respite care. Carers often feel guilty about having a break. However, this will help to reduce stress levels and maintain physical and emotional health. It will also improve the caring relationship by introducing variety and stimulation, and ensure neither carer or cared for become socially isolated. Respite care may range from someone occasionally sitting with the person cared for, to their regular attendance at a day center or club, to their going into a nursing home for a short stay. It can be as long or short as needed, for example, a few hours, a day, a few days or a few weeks. Friends and family are usually happy to help, provided that they do not feel unreasonable demands are placed on them. They may be able to spend a few hours regularly with the person cared for, or have them to stay for a weekend now and then. Help with household chores, such as ironing, laundry, or hoovering, or help with shopping or collecting prescriptions may reduce the burden on carers indirectly. Day centers provide a safe environment away from home for a few hours. Transport and lunch are usually supplied, and other services such as hairdressing, chiropody and bathing are sometimes available. Some centers may not be able to manage more dependent people. In some areas, the local day hospital may be able to provide patients with regular rehabilitation sessions and address any medical and nursing needs, whilst also providing respite for the carer. Sitting services or voluntary helpers may provide general care and supervision for a few hours, or overnight. Some organizations may be able to arrange outings, or other activities depending on the needs of the person you are looking after. Holidays that cater specifically for the needs of dependent people can be arranged, either for the person alone, or both together. Doctors, nurse or social worker can advise on sources of support and outside help. Family members of patients with Parkinson's disease may benefit from sharing questions and concerns with like-minded others. Attending support groups may help to better coping with loneliness, depression, anxiety, low self-esteem and isolation feelings that are connected to the illness. Being a part of that kind of social networks contributes to better cope with psychophysical burden that affects caregivers, while supporting them in keeping their own space, apart from problems related to Parkinson's disease. Support groups may give advices and information about health protective behaviors and useful links. There are several resources available to help you find a support group, including your neurologist or physician, local community calendars in local newspapers, and websites of national Parkinson's disease organizations.